So peripheral arterial disease is one of the most common conditions a vascular surgeon will see. Essentially, peripheral arterial disease is plaque that builds up in the arteries from risk factors just like people who have heart disease can get. The plaque can be due to some combination of cholesterol, high blood pressure, diabetes, smoking, and genetics. And people may have all, some, or only one of these risk factors. And cholesterol is circulating throughout your body, and why it may choose to build up in your left leg and not your right leg, or your right arm and not anywhere else, nobody seems to know. But once plaque builds up in your arteries, patients may develop pain with exertion that's typically relieved with rest, whether that's in their arm or their leg or other parts of their body. And it may not even be pain, they just may be walking and one of their calves gets weak or tight, and it's typically due to the muscles being starved for blood and oxygen and nutrients when people exert themselves or go upstairs or walk a great distance. The good thing is, if no intervention is undertaken other than exercise and controlling your lifestyle, 90% of people will never go on to have problems such as a limb loss or an amputation. The problem is when people start to undergo interventions, and every intervention we do, it doesn't matter who we are, will fail at some point. And then, depending on what the intervention was and what the indication was, many patients unfortunately are worse than they were before you started the process. And so our group typically recommends lifestyle modification first, with exercise, controlling your sugar, controlling your diet, stopping smoking if you're a smoker, and seeing if that alone is enough to relieve your symptoms. However, many people, that isn't good enough, and they do go on to progress and have worsening disease or worsening symptoms, and then we do intervene, whether in a minimally invasive fashion with balloons or stents, or ultimately, if that's not possible, we can do surgical bypasses around the blockage. The good thing about us as vascular and endovascular surgeons is we have all the tools in our armamentarium, including minimally invasive and maximally invasive. And sometimes a minimally invasive approach is the best way, sometimes maximally invasive with a bypass is the best way, and sometimes a hybrid approach of some combination of surgery and stenting is the best way. And our group works collaboratively to come up with the best treatment plan that encompasses all of those potential options.